My name is Dr. Jessica Okanlawon, and I'm a psychologist and a consultant, currently working in Nigeria helping individuals that have autism spectrum disorder, also known as autism.
What's the simplest way for people to understand what autism spectrum disorder is?
Okay, so autism spectrum disorder, also known as autism, is literally just an impairment of social and communication interactions. So pretty much how an individual or a child interacts socially with individuals is affected, as well as their ability to communicate. Also, oftentimes there are stereotypical behaviors or repetitive behaviors that an individual with autism would normally display.
So, how does it first get diagnosed?
Okay, so pretty much a diagnosis can happen normally between 18 and months and 3 years old. And a psychologist like myself or a behavior specialist would normally be able to diagnose it. And there's no test that you can actually run on a child, like taking a blood test. It would literally be someone sitting down and observing the child, finding out about their developmental delays, where they should be, maybe the things that they're not doing, and then they would be able to give you a proper diagnosis of autism.
What usually brings parents to the point where they feel like their child needs to be tested?
I think oftentimes, because of that age group of 18 months to 3 years, a parent notices that their child is not hitting certain developmental stages. So maybe they're not talking. Most kids their age are talking, or maybe they have a lack of eye contact, or they're just doing some things developmentally that are not age appropriate. So there's a delay in it, and oftentimes that's when parents will want to find out, what's wrong with my child. They're not talking. Normal kids their ages are speaking, and that's what prompts the alarm literally to reach out for support.
Why did you decide to go into this line of work?
So the reason why I decided to go into it is because my younger brother Alexander was diagnosed with autism at 18 months. So pretty much it's been a lifelong journey as a sister, and it developed my passion, which eventually turned into being my career. So seeing my brother look so normal and not being able to communicate and speak was just what made me want to get into this line to help other people.
And how has it been as somebody on both divides, as a family member and also as a professional
Caretaker.
caregiver?
I think for me, I actually have the best of both worlds because I literally raised Alex with my mom. Of course, with the help of different professionals as myself now as an adult. But I think it's great because you get to understand what a family feels personally, but then also what you can do to help them. You can do to help them professionally. So I believe that I have the best of both worlds because I'm actively still living the life. My brother still has autism, highly improved. He's living independently, has two jobs, he's working, he's doing so many different things, activities during the week. He has a social life, etc. So there's so many things that can be done to make life as normal as possible for them.
Two things. First,
Okay.
how does the family usually feel? Can you describe, you've been there, so can you describe what it's
Yes.
like?
I think personally, I remember when I was younger, I just didn't understand why my brother looked so normal but couldn't speak. He would always line up toys and different things and put them in a certain order. So I just thought that Alex was really, really neat. I just wanted everything to be in place. I think for my mom, because it was one of my aunts that actually noticed that he wasn't hitting some developmental stages. I think my parents were in denial at first. It's very hard, especially back then. We're talking about almost 26 years ago. Autism wasn't as popular, for lack of a better term, as it is now. The different resources that are available now weren't available 20 something years ago. So it was difficult as a family because you have a child, a newborn child, you're anticipating them growing and developing normal, and then all of a sudden you hit these delays. So I think it can be a sense of parents go through a sense of denial initially in the beginning. But I always tell parents, go through it, go through the motions. But the next thing you need to do is literally now check out of that and do what you need to do to support your child. Because the more families in denial and the child doesn't get services, the more it can be difficult for them to get the services that they need the older that they get.
And when they check out of that and you step in as a professional, what is the process usually like?
So the process normally, depending on the child. So, for example, if a person wanted to find out if their child had autism, I will sit down and do several assessments as well as observational meetings, either at school, at home, in different places that the child will be in their natural environment, and then literally develop a report for them diagnosing the child whether they do or do not have autism, or if they do have other disabilities. Because oftentimes it can look like autism, but it could also be just a speech delay. The child is just, having a delay in speech, and it may not necessarily be that. So sometimes autism can mirror some other disabilities, but it's not necessarily the same thing. So sitting down, doing an assessment, doing a diagnosis, and then literally what I would do is finding out what the needs of a parents are. Some parents just want to know, and after they know, that's it. Some other parents want to find out what they can do to support their child. So what I would do as a professional is now break down what I could offer, my independent services of either consulting or literally sitting down and developing a treatment plan in order for the child, depending on whatever their age is and whatever the goals is that we set.
What you said there's no cure earlier. So what does the treatment plan usually look like?
So there's no cure for autism. Because you can't trace autism, there's no test or lab or anything you can do to diagnose autism. You can't cure what you can't trace. But there's so many things in place to make an individual with autism develop and have an amazing quality of life. For example, now the statistics for autism it's actually a new government study that came out, I think, about 6 months ago. It's now 1 in 48 children between the ages of 3 and 17 are diagnosed with autism. And it's constantly growing. I remember during Alex's time, I think it was like 1 in 200 or something like that. And now it's literally like 1 in 50. So the numbers are growing and they'll continue to grow. I think for a family, it's just depending on what it is that you would like. So for example, diet is a form of a therapy that can be used. That's like a gluten or casein-free diet. So maybe making sure that your child doesn't have a bunch of sugars, or limiting their diet to a certain things, because certain foods can cause some behavior issues sometimes. There's occupational therapy, and that literally just helps a child understand day-to-day activities, independent living, how to dress, how to write, how to cope in normal day living. There's vocational therapy, which is building skills for an individual or a teenager to have into adulthood, which comes with getting a job, essentially. There's behavioral therapy, there's cognitive therapy, there's speech therapy. There's so many different therapies that a family can utilize, but I believe that everything is tailor-made, customized, so it's not a one-size-fits-all for each family.
You said earlier that your brother lives an independent life.
Yes,
so that is possible for people with autism.
Definitely, yes. And Alex is nonverbal. So Alex started speaking and then lost his speech at 3.
That can happen.
Yes, definitely. Some individuals speak. Some of them are verbal. Some of them are not verbal. He was verbal in the beginning and then became nonverbal. And it got to a point where we tried, to do rigorous speech therapy. But the speech therapist, what I loved about her back then was she just said, we can do this forever and ever, but there's no guarantee that Alex's speech will come back. So let's develop ways that he can actually communicate with you and other people so that he can have the best quality of life. So there's so many things that can be done. Alex lives independently. He has his own apartment. He lives with 2 other guys that have autism. They go to work together. They do art therapy. They bowl. They go out on outings. They go on vacation. They do different things together. So he's living an independent life, just as you and I would.
With the patients that you provide care for, this is always the goal, to get them
For me, it's independence. Because yes, you can have someone that's in your home caring for your child, whether it be a nanny or a therapist or a professional such as myself. But what I strive to do is to allow the child to gain independence, just so that they have a normal quality of life. So the things that they may not be able to do, we have some kids that are unable to hold a toothbrush, and that's because they have fine motor skills. So helping them learn to grasp a toothbrush and teaching them the steps in order to be independent to do that. So it's literally from early onset, we can help a child from as early as 18 months all the way until adulthood. So it just depends on when the client comes into play and what the family wants.
You're living and working in Nigeria right now.
Yes.
What is that like? Because I know that we live in a society where there's still cultural and religious reactions that people have to
Yes.
things that are that have medical explanations, so what is it like, and what is the thing that you want Nigerians to understand about autism?
I think for me, because I'm Nigerian, I've traveled to Nigeria so many times to visit family. My father is here, my brothers are here. The environment is not foreign to me, so it's like a second home to me. But because I was working in the United States for, I think, probably over 17 years, that's literally where I developed my career in psychology and working for the State Department. It's a completely different environment because oftentimes you have parents that know what they want, and that I can also let you know what's actually possible. So sometimes it's a thin line between reality and a fantasy of what your desire of what you want your child to accomplish or achieve. So sometimes I run into individuals, they don't know what to do. Or they have an idea of what they feel like they want their child to do, but it's also just bringing them to the reality of, yes, this is what you want, but this is what's realistic, and let's just build step by step to see where we can get the child. So the only thing that I would probably find challenging in Nigeria is, like you said, the religious stigmas and things that come along with having a child with a disability. Some parents actually do have their kids in a secluded in a home or living in another country, and each family makes and tailors their decision on exactly how they want to flow with their child. But what I would best believe would work most is just giving the child everything and all the support that they can need from family, from professionals, academically, socially, just so that they have the best quality of life as possible. All right, so this is an example of literally a physical schedule that I would develop with a family. It literally just breaks down from the morning when a child wakes up all the way to the evening. And pretty much it's, wake up, make your bed, brush your teeth, get dressed, have breakfast and medication, have academic time, etc. So like I said, it's completely custom to the individual that I would be working with, the needs of the family. And this is literally just a physical schedule that I can have as a reference point, and also the family. The second addition to this would be more of a picture schedule. And this is what I would normally have in place for children or adolescents or individuals that are nonverbal and they're unable to communicate. So literally all it is this print form in picture form.
So that's for the child.
For the child. And this literally helps them also to know what's coming first, what's coming second, what's coming next. The reason why this is important for me and for them working is because you always want an individual to know what's coming next with autism. It lessens and minimizes the gap for behaviors because oftentimes when a child is idle, behaviors come to play. So literally,
can you explain what you mean by behaviors?
So behaviors are different for everyone. Some individuals can have some repetitive behaviors that they do. For example, maybe flapping, rocking back and forth. And the correct terminology for that would actually be steaming. Steaming is self-stimulated behavior. We all steam. Steaming could be you being in a meeting and literally tapping your fingers on a piece of paper or twirling your hair. But for an individual with autism, steaming would be self-stimulated behavior. So if a child is overstimulated, they would do some flapping, jumping, rocking, or turning their bodies different ways just to literally calm down the overload of sensory input. If they're understimulated, they would also steam in order to give themselves the needed sensory input that they need. For someone that's highly excited, very happy, or even upset, in order to manage their emotions, they could also steam. So steaming, to me, if it doesn't affect their ability to work, I believe it's quite all right. Just because it's a way for them to be expressive and you don't want to limit their ability to express, since one of the impairments of autism is the inability to communicate. Yeah.
Okay, so
so this is the schedule literally. So an example of a schedule would just be a picture schedule, and these items that you see are literally called PECS, P-E-C-S. They're picture exchange communication symbols, and literally they're just word forms in pictures, and you would have them listed. So for example, hygiene, getting up in the morning, brushing your teeth, taking a bath. The next thing would be for you to have breakfast, maybe to have medication if you do take meds, So literally, and the next thing thereafter, iPad, go visit the doctor and come back home. So you have different options. For example, so first I have hygiene, then I have breakfast, etc. Once they finish, what they would do is literally take it from one section. So I will have, I now have, and I have had. So literally showing them what they finished and then showing them exactly what's next. So there's no confusion as to what comes next. They know exactly what it is. So that's another form. These are also PECs. PECs are also used for communication. Literally, this is can I, all done. They're literally forms of sign language, but just in a picture version. Here also is an example of a communication book that an individual with autism, depending on their age, would take around. And literally, it just has so many different examples of things. So Skittles, Barney, rice, walking, a ball, pizza, dancing, haircut. And funny enough, this is actually my brother's communication book.
Oh.
Yes, from almost about 20 years ago, actually.
Oh, wow.
It's actually been in great condition. So literally what you would do is let them tell you what they would want. So in the event that a child is nonverbal and they're unable to speak to you, they could literally just pull out this and say, point to it. And they're telling you that I want milk. So he may not be able to physically say it or verbally say it, but he can actually look for what he wants and say, okay, I want milk and I want to watch Barney. So literally you'll find out what the needs, wants, the things that your child likes. And literally what we would do is just develop these packs of all sorts, different categories in order for them to communicate.
And do they still have to use this in adulthood?
Depending if they're nonverbal, I mean, there's different things like sign language they can use. This is another version of one that some kids that are teenagers use, or some adults, where literally, so it's like I said, it's the same thing, and it's a grid that can be interchanged. And literally, they would just say, I want, and whatever it is that they would want, they would press it. So I want pretzel, and this also has the ability to have voice output. You can record a voice output depending on if it's male or female. So they can tell you, I want pretzel, and it would speak for them. So it's literally giving them the ability to talk. There's so many things that could be done now on an iPad, with an iPhone that gives them the ability to communicate. There's devices such as this that you can actually, for someone that's able to comprehend and has comprehension ability, type what it is they want and it will just provide a voice output for them. Mm-hmm. And this Board Maker Plus literally is the manual version of all of this.
Oh, okay.
So most families would need a Board Maker Plus, a program like this, in order to develop PECs. You can develop a schedule and all these different things, but because of the internet now, you can definitely get some picture exchange items or pictures of stuff online, but this literally gives you a plethora of information. Mm-hmm. So you can develop schedules, school schedules, home schedules, and different things that you would want to for education purposes.
Speaking about education,
okay.
Nigeria education access, even to medical services, okay. What do you think needs to be done, whether it's policy-wise or in terms of actually having the infrastructure to support people who are living with autism?
I think it's very important. Like I said, coming from the U.S., those are some of the things that, I see that can cause a barrier or divide for someone needing support, because everyone cannot afford having a professional consultant or a professional come into their home. And a lot of these individuals that have autism, it's not just a psychologist that they need. They need a speech therapist, they need an occupational therapist, they need a behavioral therapist. They need all these other additional things, and as a team that comes together to support them. So my desire eventually would be to have a school that supports just kids that have special needs in general. Of course, it could be tailored to a specific area such as autism, but that's one thing that I see that's lacking in Nigeria. There's so many schools that are accommodating individuals with disabilities, but not necessarily catered to a specific disability or an array of disabilities. So yeah, policies need to be put into place. The government needs to see that There's no need for kids to go to South Africa or travel to UK or travel to the US when they're living in Nigeria. If we can bring professionals here, such as myself, we can provide an infrastructure that would actually provide support. The government has funding for so many things. Like I said, some families are unable to, afford a plethora of services that the child actually needs. So finding organizations such as myself that may be able to say, hey, I can train a staff or two in order to be able to see what to do, as a pro bono service to the community. Because like I always tell people, all this is good and well for people that can afford it, but then you also have the masses that can't afford it. So how do you reach those individuals that actually cannot afford it but actually really need the help?
Okay, and what would you say to anybody who is looking to get into the space of caregiving, make caregiving a career?
I think for me, what I would always tell people is everyone's not a caregiver. As much as you love people and to take care of certain people, caregiving is a complete lifestyle. Being a caregiver literally is dissolving yourself of all your sometimes desires and needs and literally taking care of this other person. But if you have that's your passion and that's your drive and your purpose in life, then I would say by all means go for it. Dealing with an individual with autism or disability in general sometimes can be difficult on the family. So that's you providing that care, love, support, and also knowing that it's just not about the individual, but about all the individuals that are around them, their families, their church members, academically, teachers, etc., and providing that support. So my thing is, if you love it, also shadow a therapist, a psychologist, someone that works with special needs, or go to a school with special needs, or even maybe visit your Sunday school churches that have individuals that have special needs and see if it's something that you like to do, something that you would actually want to learn as a skill, and then go for it.
Okay, yes. And finally, what is fulfillment to you?
I think fulfillment to me is literally taking all these things that I have to offer, and if it's literally one thing, having a child being able to communicate and say, I want to play, for me that's fulfilling, especially if they didn't have the ability to communicate before. For me, it's all about baby steps. What I always tell parents and also professionals is you can't do everything. Yes, you may want to provide speech therapy, provide occupational therapy, and do all these things, but it's about knowing what's important for you as a family and for the child as an individual and targeting that. So for me, fulfillment is just a child learning to communicate, whether it's using PECs, the ability for them to brush their teeth without support, doing all these things that we all thought that they couldn't do, but they actually now have the skill to. So for me, that's completely fulfilling.
Thank you very much.